The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. I hope that you guys could hear me before, but if not, we have quite a few folks with us, and we're waiting a minute or two more for everyone else to join. So we will get officially started here shortly. Hey, everybody. So for those who just joined us, we are waiting for a few more folks who are still trying to log in, and then we will get started. So bear with us, and we will start here in just a moment. So I see that the few folks who had trouble are on, so we'll go ahead and get started. Thanks, everyone, for joining us. My name is Allison Clements, and I'm with the National Juvenile Justice Network, and I just wanted to welcome you to our webinar, which is focusing on framing youth justice through a health lens. Before we get started, I was just going to run through a couple of housekeeping items. So when you enter the conference, please make sure that you've enabled your audio. It looks like most folks can hear me. If not, send me a message through the questions or chat box. We can figure it out. And just so you guys know, there'll be two options, either your computer speakers or through the phone. It's much clearer if you dial in through the phone. So just want to allow you guys to get the best listening experience. So please dial in, and you should be able to change that setting in that control panel that you guys see. Because we have so many folks on today's webinar, everyone's muted, but once we get to the question and answer portion, we will unmute folks. So feel free to either raise your hand through the dialog box or present a question in the question box, and we will make sure to call on you and raise that question. If we do have too many questions, we will make sure that we get answers to you guys via email afterwards. So just know that we'll get around to your question in good time. On your screen in the upper right-hand corner, you'll see the control panel. If you want to minimize that during the presentation, click on the orange arrow, and the panel will be hidden. If you click on it again, it'll expand to its full size. And lastly, the webinar is being recorded, and it will be posted on NJJN's website in the next day or two. So once it is posted, we'll be sure to send it around to all the registrants with information in the slides from today's presenters. So with that, I'm super excited to turn it over to Kim and to Jason. As folks may know, NJJN has been talking about and really exploring what it would mean if we responded to violence using proven public health approaches. You know, we would see violence as an epidemic, and we'd rush to provide triage services and long-term investments that would really cure violence. And really, in short, it would fundamentally change how we respond to youth in trouble with the law. So I'm super excited to have Kim Gilhuly, who's leading a movement for public health responses to youth justice, and Jason Smith, who's really been implementing this on the ground in Michigan. A little bit more about Kim and Jason. Kim is the Program Director of Health Instead of Punishment at Human Impact Partners. She began Human Impact Partners Health Instead of Punishment in 2011, which uses public health research, advocacy, capacity building, and action alliances to reduce the disproportionate impact of the criminal and juvenile justice systems on low income and communities of color in the U.S. In May, she convened the Second National Criminal Justice and Public Health Alliance to work toward a public health approach to criminal justice problems. And as I mentioned, Jason Smith, who is an NJJN member and Why July alum, is the Michigan Council on Crime and Delinquency's Juvenile Justice Policy Associate, where he leads the legislative advocacy efforts and serves as the coordinator of the campaign to raise the age of juvenile jurisdiction in Michigan. Additionally, Jason is responsible for managing several projects that aim to reduce the use of out-of-home placement through the statewide expansion of effective community-based program for justice-involved youth. In the past, Jason has served as lead researcher and co-author of Restoring Kids, Transforming Communities, a report that details the use of juvenile court diversion programs in Michigan. So with that, I'm going to turn it over to Kim to get us started. I'm going to allow her to show her screen, so give us just a second while we transfer to her screen. And we can see it.
Great. Did that work? Okay, let
Yep.
me do a little so thank you so much, Allison and Jason and everyone who's joining, and I'm looking forward to the conversation about how can we use, maybe I should minimize, how can we use Health Lens in youth justice campaigns and systems change. So, I'm trying to figure out how to, all right. Go to the next, there we go. So I just want to talk a little bit about the justice system and justice system reform and why it's a public health emergency. Give a few examples of how Human Impact Partners has, and that's my organization, has incorporated this public health approach into juvenile and criminal justice. And then how, some kind of examples of how public health departments specifically can help and how you can ask for help. And then we'll have some time after Jason's presentation for questions. I'm not going to spend too much time on this because, thank you, Allison, you've introduced Human Impact Partners, which has been around since about 2006, and I've been with them for since 2007. Currently the Health Instead of Punishment program, which is our criminal and juvenile justice work, bringing a public health lens, voice, and data to criminal and juvenile justice system reform. So since you already heard most of that, the only thing I'll also say is Human Impact Partners is based in Oakland, California. I, in particular, work I live in Massachusetts, So just to start, and I'm sure this will be no surprise to anybody, but I think that justice system reform is a public health emergency. And we did a evaluation last year of California public health departments and looking at their successes and barriers to being involved in criminal and juvenile justice system reform. And a person from the state health department said disparate incarceration rates and everything that drives them are a public health issue. And the same structural and institutional racism that drives mass incarceration also drives health inequities. So I share that because I believe that public health departments and public health practitioners are getting to the place where they actually are starting to believe that justice system reform is public health, but for the most part, are seeking ways to get involved. There are health departments that are actually doing amazing work, but they are probably in the minority in terms of people involved in criminal justice system reform. So just to say, these shouldn't be too surprising to you, but from a public health lens, the deeper the one gets involved in the juvenile system, the worse health outcomes there are. And this is, like, I would say this is a summary statistic from a study that showed basically that the deeper you get into the system, the worse premature mortality there is. So I think that it's a summary because it takes into account all of the different exposures, as we say in public health, that a youth would experience at varying stages of the juvenile system. And then in addition, we know that kids who get caught up in the juvenile system already have a fair amount of trauma in their lives. And so being involved in the juvenile system is further traumatizing those youth. And this is from a study done in Florida looking at kids who were involved in the Department of Juvenile Justice and their experience of adverse childhood experiences. So you can see it's incredibly high. And then this slide, again, should be no surprise, but if for public health in particular, if we're concerned about health inequities by race, we should be very concerned about the juvenile justice system and the criminal justice system. And these are, some of these are from our reports. The upper right is from a report we did in California on Proposition 57, a specific part of Prop 57, which looked at direct file of youth to the adult system. And you can see by race, you know, people are disproportionately, youth are disproportionately being sent to the adult courts. And then in the lower left in Michigan, we did a report, I'll talk about it in a second, about youth arrests and the health impacts. And again, disproportionately by race, Black youth are being arrested at much higher rates. And then the middle stat is from a national report saying that minority youth account for almost 70% of offenders in residential placement. So at all stages of the juvenile system, there are these inequities. So that's just making the case that why I believe in particular that the justice system, the juvenile justice system and criminal justice system are public health emergencies. So I want to talk a little bit about some examples of the way Human Impact Partners has incorporated the health lens into juvenile justice system campaigns for reform. One I mentioned earlier, and Jason actually participated on this. We worked on a campaign that involved looking at youth arrests and the health impact of youth arrests. And this was in partnership with Moses, a faith-based community organizing group, the Michigan Public Health Institute, the Wayne County Department of Health, Michigan Council on Crime and Delinquency, and then there were a bunch of other organizations, agencies, and individuals on our advisory committee. But I guess the three examples I'll talk about, I have them separated according to kind of our strategies, which is to provide the research. And then once we know something is good or bad for health, we then move forward with advocacy in partnership with, and really letting our partners take the lead on that work and the strategy, and then with the action alliances. So, you know, briefly, the research showed that youth arrest has negative physical and mental health outcomes, everything from, you know, injury due to police violence or being detained or shackled, even if you did not go further into the system, and mental health outcomes, as well as what we call impacts on the social determinants of health, or things that determine our health behaviors, like whether or not you can get a good education or jobs. And so being arrested as a youth had impacts on the ability to move forward in your trajectory in life as well. So we had, you know, this report, did a press release, paired it with the report that Allison mentioned that Jason authored about youth diversion efforts throughout Michigan. And I know that one thing that resulted were some meetings with Detroit elected officials and police about a particular type of, I forgot to say, we also highlighted solutions and youth diversion solutions that people could do. And so the meetings in Detroit were focusing in on the option of police writing civil citations instead of arresting kids. So I think just outcomes, I think some of these relationships did not exist before. I know the Detroit Health Department got involved and had not been thinking about civil citations, and they actually enabled Moses to make some connections with elected officials and with the Detroit police. Michigan Public Health Institute had not been involved in this arena before, and while I don't know if they did anything about this particular issue, it made them easier to get them involved, and Jason will talk about the Raise the Age campaign. And so I think some of the relationships led to conversations, and I know Moses is still working on this issue of civil citations. We just released this last year. So another example of bringing the health lens to conversations around the school to prison pipeline in California, we've done several health impact assessments on school discipline policies, both looking at zero tolerance policies and the health impacts of those, as well as restorative justice programs, positive behavioral supports and interventions. And basically the research shows that discipline policies and practices impact education, which impacts the life trajectory and health outcomes. There's very clear connections to a person's ability to get an education and their health outcomes. And then also risk of juvenile and adult system involvement, and that has clear impacts on health. And so with these different reports, youth actually presented the findings to school administration, to local press. Youth published editorials in a local paper. Parents used this, I didn't write this down, but in advocacy in Los Angeles. And we worked with Cadre, which is an organization of parents in Los Angeles, and Merced Organizing Project in the Central Valley. And then also we did a project with the Health Officers Association of California. And some of the outcomes of this work include, in Merced, they actually used the report and the advocacy and conversations to hire a restorative justice training consultant and secure grant funding for the program. And they continue to have a focus on mental health, because that was one of the things that really came out in all of these reports, are the impact on kids' mental health of school discipline policies and kind of the cycle. So the last example I'll give of human impact partners work is some work we're doing in 3 states. And this is actually technically not a juvenile justice campaign or policy. This is in the adult system, but it relates to youth and health outcomes for youth. This is in 3 states, we're working on legislation that would expand the use of alternatives to incarceration for people who are parents of dependent children. And what we know is that in the parental incarceration is a specific sort of trauma called an adverse childhood experience, and that it ends up leading to poor health, both for the parents and for youth. And this has been actually really helpful in the way, in our ability to frame the issue and talk with health stakeholders, to have a lot of research on adverse childhood experiences and to be incorporating that. So the advocacy we've done on this is we have actually been we've been reaching out to public health stakeholders, medical personnel, doctors, nurses, associations. We have over 100 health stakeholders who signed on in support, and this is in Massachusetts, where the bill is furthest along. We also have about 10 agencies and organizations, from health systems like hospital systems, public health institutes, as well as provider organizations. And we've been sending out action alerts and getting calls into the legislature from those health organizations. And I think that it's actually made a difference when legislators hear, oh, there's a bunch of public health people who have an eyeball on this piece of legislation. Our alliances are generally with all these organizations, but they are all part of the National Council of Incarcerated and Formerly Incarcerated Women and Girls. And the bill is in play. It's being introduced in Louisiana and Tennessee, and we're partnering with groups there. And then in Massachusetts, it's made it through kind of through the House and Senate, and it's in conference committee right now. So I also, sorry, would say with that, it's enabled us to have these conversations with public health departments that might be not on board with getting involved in juvenile justice system reform yet, and they're open to having the conversation. I'm just mentioning a couple of other things that we've done. So one was a juvenile injustice report, a health impact assessment in California. That's on the Prop 57. Raise the age and its health impacts in Michigan, which Jason's going to talk about. And then we're currently engaged in a study and advocacy looking at youth auto thefts and health in Florida, and then school policing in California. So this next little section is just talking specifically about public health departments, and I thought it might be interesting to talk about what can public health do for you. And so if you are a public health practitioner or you are familiar with public health, you may know all of this, but basically public health, we're concerned about population health versus doctors, nurses, and medical practitioners who look at individual health. So we're concerned about the health of populations, and in particular about health inequities, or how by race and income people are having different health outcomes. And so public health departments have all of these kind of skills that can be helpful to your work. One is public health are natural conveners. We bring people together, and people consider public health to be neutral and trusted. And I hear this over and over again, is people feel comfortable with public health bringing people together because of their neutrality. Public health is all we do is provide evidence and data. So you can ask public health practitioners for that, whether they be public health departments or academics. We evaluate and monitor. We are connectors with other agencies. So for example, if on a county level, you have been having as an advocate a hard time having a conversation with your local probation department, getting public health involved might enable an agency to agency kind of conversation. Also, public health can represent community partners in some of those conversations, but even more importantly, they can bring directly impacted people into policy change discussions. So these are just some of the things to think about. And I just want to give two examples of how public health departments have actually taken on some justice issues. One is in Los Angeles County, which the public health department there did a really interesting collaboration, ended up kind of leading this collaboration, although they weren't at first leading it. So to look at youth diversion programs and use, and were they evidence-based, and were they being used across the county equally? So this slide is just to say that the use of early effective diversion has really decreased youth arrests, which in Los Angeles County, I think in 2015, there were something like 13,500-ish youth arrests. So it's a huge county, and it's the largest jail system. So it's really helped, diversion has really helped to decrease arrest and referral to probation. So this is just kind of the end result, but I'll talk to you about the process. The LA County Department of Public Health was actually involved in a collaborative that at first was looking at truancy programs, and the collaborative included advocates, for good education, good public education, parents. It included education system, included truancy programs or providers of those services, law enforcement, the public health department, youth themselves. And so first they looked at truancy programs, and the health department's angle on it was really from research and evaluation, are we providing evidence-based programs? And they ended up really improving some of the programs and evaluating some, but the collaborative decided, let's look at diversion. So use the same collaboration and look at diversion programs. And what they found, they like assessed the entire county's programs, and they found they were being implemented and used at varying different levels. Some did not have any evaluation, some had great evaluations, and they brought everyone together in a convening that was held by the public health department and a juvenile court judge, and then everyone else. And they did what public health does, which is they did a survey at the actual convening, and they found out all sorts of things about what people knew about the diversion system, what people knew about the outcomes, what people needed in terms of guidance. And they ended up writing a report with their assessment and the results of the convening and making a bunch of recommendations and taking them to the Board of Supervisors, which is like the county commissioners. And the county, the Board of Supervisors ended up funding the collaborative through the health department to actually implement a bunch of those recommendations, and that is currently happening right now. So I think it's a good example of all of those things, that the convener role, agency to agency, bringing directly impacted into the conversation, using data, et cetera. The last example I'll give is just, this is again more about maybe the criminal justice in general, but the Minnesota State Department of Health was asked by their legislature to look at the health impacts of mass incarceration. And they convened state agency, mostly state agencies, but also a few county organizations and community organizers in 2 processes, looking at systems mapping and narrative development. And I think it was interesting because really the legislature had a very short letter asking them to look at the impacts. And they said, let's do these processes to get people talking and not just write a report. And so it's resulted in a bunch of deeper collaborations and partnerships. And in particular, I heard that the Department of Corrections is now calling themselves a public health agency. And they also are collaborating on like data provision and an emerging narrative about how incarceration impacts health equity, and counties doing some work. So I'm pretty much gonna stop there. I want to say also that there's all sorts of other things that people across the country are doing that I'm not capturing. And one, Allison recently shared with me some work that's happening in King County, Seattle area, with an executive order that calls for a public health approach to juvenile justice, and the implications that has for how services get delivered is massive. So that's really exciting. I'm done.
Thanks, Kim. And I'm going to turn it over to Jason, and then we'll be sure to open it up for questions. But I want to make sure he has time to go through his. So Jason, you should be seeing, should be allowing. There we go.
Can you see my screen?
We can.
Yeah.
Thanks.
Okay. Yes. Thanks, Allison and Kim, and thank you everybody for allowing me to share our experience in working with human impact partners and trying to incorporate a public health approach to our work in justice reform. I work for the Michigan Council on Crime and Delinquency, which focuses on criminal justice and juvenile justice reform. My focus is specifically juvenile justice, and today I'm talking about the Raise the Age campaign. I apologize, I don't have a slide with an update on where we are, but essentially bills have been reintroduced as a large bill package that includes legislation to raise the age of juvenile jurisdiction to 18 here in Michigan. We're one of the last 5 states to do so. In addition to that, there's other legislation in that bill package, a bipartisan bill package, that would remove all youth from under the age of 18 from adult prisons and jails, and other legislation that tackles issues that impact young people entering the adult system. Currently waiting for a cost study to be complete, which we're hoping will be done early next year. And from that point, hopefully we'll be able to move on to actually having hearings and moving the legislation forward. Because we knew, because we knew that we had a little bit of time from the point of reintroducing our legislation to actually having hearings and seeing the legislation move, we wanted to take the opportunity this go around. This is our second time advocating for passing raise age legislation to expand our support network for the Raise Age campaign. We've been reaching out to various stakeholder groups, the business community, stakeholder group, faith-based organizations, but in particular, we really thought it was a great idea to expand our relationship with public health stakeholders in Michigan and bring them into the fold as supporters of Raise the Age for a lot of the reasons that Kim outlined in her presentation. Public health stakeholders are viewed as neutral and trusted members often of county departments, if we're talking about local public health, community health departments, the public health departments, and they have the ability to frame messaging using the public health perspective that gets beyond looking specifically at just the offender or the offense and looking at the issue of justice reform as a public health need. One of the things that we thought would really be a benefit from working with public health or health stakeholders is developing messaging that could help us reframe our Raise Age talking points and hopefully a lot of our work going forward to change the narrative in how young people or people in trouble with the law in general are viewed. And the example I try to use often in discussing this is the example of how youth who are waived to the adult system, which under the legislation that's being proposed here in Michigan would still happen to a certain extent. There would still be situations where young people would be automatically waived to the adult system for certain offenses. They tend to be the more violent offenses. We wanted to shift the narrative that unfortunately leaves them in isolation or on an island, separate from the young people that would be captured in the Raise the Age legislation. It kind of leaves them to a place where they're often forgotten about. We wanted to break the false narrative that violent and nonviolent youth are different. We view them as kids, and we feel like the public health perspective allows for that. That instead of focusing on the offense, it allows you to acknowledge that violence is a public health issue, that it's okay to want to hold young people accountable, but it's possible to do it in a way that acknowledges their status as young people, acknowledges often that they've experienced trauma and are victims of violence themselves, and that also they should have the opportunity, in addition to being held accountable, the ability to repair those harms, participate in more restorative practices to address the harm caused to other victims. And we thought it was a benefit in incorporating health voices in the Raise the Age campaign because in developing that messaging, it would allow public health partners that join on in support of Raise the Age and would like to advocate for the legislation's passage to do so using language that's familiar to them, using language that speaks in their terms of framing things in the public health perspective. So in our partnership with Human Impact Partners, Kim mentioned that we worked on a previous project in Detroit, but in relation to Raise the Age, HIP has helped us to connect with state-based public health professionals that were helped to form an advisory committee that worked on a report that Human Impact Partners developed that I'll outline in a minute. Human Impact Partners actually organized the committee meetings for that advisory group to help them gather input for the report, and they helped develop a specific sign-on letter targeting public health officials and organizations that they can sign on to show their support for Raise the Age en masse. And here's some, at the bottom of this slide, is some of the language that's included on that sign-on letter. That has been a tremendous help for us. We hope to do that with other stakeholder groups, but of them all, we feel like the public health sign-on letter is the most further along. Additionally, as Kim mentioned, is a great benefit in partnering with human impact partners and public health stakeholders. They connected us with a group here in Michigan called Michigan Power to Thrive, which Moses is a part of. Michigan Power to Thrive is a collaborative of public health stakeholders and community organizers that are focused on accomplishing certain goals in regards to social justice reform. And this year, Michigan Power to Thrive has made Raise the Age one of their priorities. We worked with members of Michigan Power to Thrive and HIP to develop a specific public health fact sheet that our public health stakeholders and we can present at events and during doing public education to other groups and other public stakeholders that may have, where the messages that are public health focused may appeal to them. And here are some examples of folks that have signed on to the sign-on letter so far that HIP and helped us to create. The Michigan School of Public Health, several county health departments that have been really influential and a huge help in developing key relationships in local communities, especially around county commissioners, building support amongst the counties to pass Raise the Age. And here is the report that Kim referenced. Human Impact Partners I think it was early November, the first week of November, released a report examining the health impacts and the equity impacts of treating 17-year-olds in the juvenile justice system versus the adult system. As I mentioned, it was heavily informed by that advisory committee that HIP helped connect us with, and we also recruited some members too as well. And we provided some content to the report as well. It was really a benefit to work with Human Impact Partners on this report because the last time that we released any large publication around Raise the Age, it was quite some time ago. And it was actually a broader report, Youth Behind Bars, really talking about youth in the adult system in general, and that came out in 2014. So in addition to outlining the health benefits of treating young people in the juvenile justice system versus the adult system, it gave us an opportunity to refresh our talking points, refresh the statistics that we laid out in our earlier report in 2014 with newer numbers as well. Here's a list of the advisory committee members. You can see that it's really a diverse group of stakeholders, though not all public health or health voices. They were predominantly the members of the advisory committee. And I wanted to give a couple examples from the report, some of the findings or some of the language that's included in the report to show how Raise the Age was framed using a public health lens. There is some overlap in the report in language that's typical to the talking points you see in the Raise the Age campaigns, that young people benefit or have better outcomes from being in the juvenile justice system versus the adult system, and there's long-term benefits and savings to taxpayers and reduce victims' costs due to reduced recidivism for having young people in the juvenile justice system. But in particular to this report, it was great to see things framed in a way that was, again, larger than looking at the specific offense or specific youth and framing Raise the Age as a public health issue. Really looking at how involvement in the justice system at any level is disruptive or traumatic, the mental health or physical health consequences of incarcerating young people, particularly in the adult system, the report really focused on, and the benefits of treating young people in the juvenile justice system. The report really flushed out that the juvenile justice system really provides more age-appropriate treatment and is more trauma-informed to address some of the traumas that come from the contributing factors that led to delinquent behavior or their adjudicating offense, and also the trauma experienced by justice involvement, as was outlined in the report. I won't go through all the language, but you can see some of the other examples of how the Raise the Age was framed using a public health approach. So in addition to the report, and through Michigan Power to Thrive, several county health departments participated in our Youth Justice Awareness Month of events we did in October. We actually held 6 events statewide. 3 of those events were hosted and organized by county health departments. And they did an excellent job. You see the flyer from the Lansing event, which was great. And towards the end of October there, that was hosted and partially organized by the Ingham County Health Department, where Lansing is. That event was excellent. They had an excellent panel. Actually got the prosecutor from Ingham County and the sheriff to participate on the panel as well and talk about and vocalize their support for Raise the Age, which was big for us. And the last event, this event actually happened in November, but the WISEM event that was held in Flint was organized by that local county public health department. And at that event, the executive director from the Michigan Public Health Institute, who Kim referenced during the Detroit project, was there on hand to present the findings of the HIP report and get people further engaged in building support for Raise the Age based on the findings of the Human Impact Partners report. So our next steps, and I apologize for being brief, we hope to continue our outreach to health stakeholders, building upon the connections that we've made through Human Impact Partners, and increase the sign-ons to the Raise the Age support letter. Our goal is to allow there to be enough sign-ons to the letter that we can share that information with legislators, and then also possibly submit it as testimony once the hearings get underway, and then support public health partners in expanding their advocacy efforts. We're hoping that sometime soon we can have an op-ed come out that would further flush out the findings of the Human Impact Partners report. That we've already heard from some county health departments that are interested in hosting additional public education events similar to those that were held during October, during YJAM, and then also encouraging them to engage directly with state and local elected officials. As Kim mentioned, local public health departments and stakeholders are really good at being kind of the neutral go-between between us advocates and local officials specifically, such as county commissioners. And that's it for me.
Thanks, Jason. So we will open for questions, and I know, Otis, you've had your hand up patiently, so this should allow me to unmute you to ask your question, Otis, if you want to pose it, and if other folks have questions, please either raise your hand or type it in the box. You there, Otis? Maybe. No question, perhaps? If so, we can't hear you. Do other folks have questions? I'm happy to relay them to the folks on the phone. That's easier. I know one of the questions that we get frequently here at NJJN, and I think, Jason, you talked to this a little bit, but maybe, I don't know if Jason or Kim wants to answer it, but really sort of if I'm going into pitch public health professionals on why they should get engaged in youth justice advocacy, you know, what is the pitch to them? What does that sound like?
I mean, Kim might be able to better answer this question than me, but for me, I really view them as a neutral voice on an issue, and that they have the ability to frame it as a looking at an issue from the bird's eye view, if that makes sense, rather than getting into the weeds of the pros and cons of a specific issue, looking at the overall negative or positive impact of doing some sort of reform, and communicating it in a way that people may be more open to hearing it than from the straight up reform advocates. Not that we can't do that as well, but I think that it holds certain weight to have an issue outlined by public health stakeholders.
Yeah, I would just
And
add, oh, sorry, if you, sorry,
oh,
Jason.
no. Quickly, I just want to give an example of the Health and Human Services Appropriations Chair in the House here in Michigan is a physician. And when I met with him to try to get him on board to start to think about how we can possibly fundraise the age if the legislation passed, framing it as a public health issue, talking about how the juvenile justice system provides more trauma-informed care than the adult system, better age-appropriate mental health treatment, really had an impact on him and really swayed him, I felt. That's just one example of how it's been beneficial.
That's great. I'm glad you shared that. And just in terms of like, if I'm an advocate and I want to approach my health department about getting involved, I think one thing that helps is to use, when you're talking with anybody who is not in your direct kind of swim lane or whatever, using the language. And I think, a lot of health departments, the issue of racial inequity and the impact on health and is a big deal. A lot of health departments have maternal and child health units. They have injury and violence prevention units. They have community health units. I mean, they're not all the same, but kind of posing it as saying this really is a health issue. I know you think it's just public safety, but I have actually been talking with public health departments to say, I really believe that we have a moral imperative to be getting involved in juvenile justice system and criminal justice system reform. So those are some things I use. I'm also happy to share slides, and if people are interested, please contact me. And we do have contacts across the country in different health departments. And also I'm always happy to talk and serve like as a go-between.
Thanks, guys. And we have two other questions that have come in. So Otis did have a question, and so his is, who should be at the table to begin the discussion of youth justice in the health service profession from an educational view?
Can you say it again? Sorry.
Yeah, so if you're bringing folks to the table, who should be there as you begin to discuss sort of youth justice in the health service profession from an educational view? So it sounds like if you're addressing youth justice through a health lens and addressing the issue of education, sort of who would you recommend being at the table? And I can, does that make sense?
Yes, that makes sense. I mean, I would say youth themselves who have been impacted by the system, the systems, whether it's the justice system, the education system. It's really powerful. I just actually went to speak at the Massachusetts Department of Public Health last week, and I spoke with Andrea James, who's formerly incarcerated. And I think, more than anything I could say, her story and her passion for system reform made the difference. So that's one. And then people who are knowledgeable, Jason is so knowledgeable about the intervention points for the legislation and what strategies make the best sense and how we can brainstorm to, often public health folks are very nervous about advocacy. And so it's really helpful to be able to brainstorm, how can we be less than advocates, but educators. And to have that strategizing is really helpful. I would say if there are people like myself and Jason who can be translators, public health advocates who are already doing work in the juvenile justice system reform, NJJN organized a great session at the annual meeting, and oh God, I'm trying to remember. Allison, what was not William, but the
Eduardo?
Eduardo, yes, has in his advocacy in Washington, D.C., has been completely using the public health framing and is a very good translator between advocates and the public health stakeholders. So those are some people I think would be helpful to have at the table.
Great.
Yep, I echo all that. Nope, as I said, I echo that.
Great. And then Chaz Arnett had asked, what are the drawbacks to potentially using a public health framework? What sort of pushback might you have encountered?
I mean, I don't know, Jason, if you've encountered any pushback.
I think that, no, nothing too bad so far. I think that's something that we always have to keep in mind, is essentially what you said, Kim, is that it's important that if you are working with county health departments to do less than advocacy, more than education, or somewhere in between on a particular issue, that they are prepared to do so, especially if you're not around as the content expert. Prepare them to answer any questions that may get into the weeds a little bit, or get really in depth around content. So I guess asking county health officials or local public health stakeholders to become involved in discussions around criminal justice, juvenile justice reform without being prepped in depth to have that conversation could be one of the drawbacks. But so far, so good with that here in Michigan.
That's good. And then I think the other thing that's come up in Michigan, and comes up in virtually like every project policy that I've been involved with, is the cost issue. And I know, Jason, we've been talking about, what is the cost for example, in Raise the Age in Michigan, the cost of keeping 17-year-olds in the juvenile justice system, where they're getting, more access to treatment and programming and educational options. The cost is higher, but really long-term, the cost is lower. In some ways, in public health, that's always going to be the case. Because we're investing now to prevent problems further down the road. And so sometimes that's a hard argument to make.
Yeah, I would say that it's easier coming from someone who's accustomed to having the long-term view on issues than me, who is trying to advocate all types of ways, why it's beneficial short-term, long-term, and everything. It's good to have that voice that can be, again, more neutral in the way that public health stakeholders can be.
Right. And I guess I would also say, public health can bring some brainstorming on how, to bring resources potentially to the table. Public health is always scrambling as well for funding, but I think there's some creative thinking that could happen.
So thank you both.
Good question.
Yeah, good questions and great answers. So I don't see any other questions. We do have time for probably one more quick question if there is one. So if so, now's your shot. Otherwise, I'll close out here shortly, but looks like, somebody took me up on that offer. Are restorative justice programs consistent with the public health lens? George in Washington was hoping to know.
I would say absolutely. I don't know what more to add. I think, we, as part of our National Criminal Justice and Public Health Alliance work, have been, one of our kind of work groups is developing a transformational narrative that treats criminal and juvenile justice, a narrative that treats the justice system as with public health values of prevention and being informed by trauma-informed principles, and do no harm is a medical value, but and I think so there's a lot of kind of values and principles that we've put into this transformational narrative, and one of them is that of accountability of all parties, including the justice system themselves, as well as those who have been harmed and are seeking restorative justice, and those who have participated in the harming. And so you can see I'm not well versed in the lingo, but I think that that is something that we've absolutely included in this kind of transformational narrative of looking at the justice system as a public health through public health eyes, basically. And if people are interested, I can share some of that work. I can send it along with the slides to Allison.
Yeah, that would be great, Kim, if you don't mind. And then I know sort of a final closeout question that folks had raised was whether we can make the presenter's contact information available. So I know I had asked you guys this beforehand, but I hope I'm not putting you on the spot by saying, yes, we can make your contact information available to folks. So we will be sure to share the slides and the recording from today's webinar. If Kim or Jason, if there's any other materials you think we should circulate or that would be helpful to folks, I'm happy to include those in the follow-up email to all of the participants, and we'll be sure to make sure that your email addresses are available so folks can follow up with you. And I think if it's not on your slides, maybe we can make a contact slide as well, just so it's easily available for folks in multiple ways. So with that, I just want to make sure to thank Kim and Jason for sharing their expertise and for everybody for joining us. Like I said, be on the lookout for an email in the next probably a day or so. We'll take time to get everything up on our website, and then we'll email it out to you guys. So feel free to follow up with additional questions. We'll make sure to get you contact information, and I hope that the rest of you guys have a good afternoon. So thank you, and until next time.
Thanks, Allison. Thanks, everyone.
Thank you, everybody.